Hi everyone, and thank you for joining me for this week's presentation, Chapter 19, eHealth. eHealth is essentially the electronic transformation, storage, data, storage, manipulation of your health data in an electronic format. Many of us have seen different types of healthcare information. About 3/4 of us are currently looking for health care information online. The use of apps and smartphones and tablets and laptop computers has helped to expand this as well. And a lot of doctors and doctors' offices and healthcare providers, such as hospitals and clinics, have been migrating from paper files over to electronic or digital health files. One of the things you may not know, if you look at the little factoid up in the right-hand corner, is that actually the federal government requires that physicians, providers, hospitals, and other types of healthcare providers that bill for Medicare services for their patients actually have to use electronic health records, or eHealth, in order to get paid and reimbursed appropriately. So when you see the figure there about all of these physicians and other types of providers migrating over to eHealth, that's one of the driving reasons. About 40% of healthcare is provided through Medicare. So you can see why that would have such an impact. Next slide, please. So just a brief introduction to some of the definitions around eHealth. As I already mentioned, eHealth is electronic information and communication technologies in the field of healthcare. Electronic healthcare is the collation of all of the data around you, the patient, about all of your medical services, your procedures, your diagnosis, your lab tests, x-rays, pictures, and whatnot, all collected in one single place. If you remember, the doctor used to go into the office and might be carrying a chart, or a nurse would come in with a chart. Now oftentimes you see them coming in with a laptop because they no longer use the charts. They have been required to move to electronic healthcare records. mHealth is very simply the utilization of eHealth in a mobile platform. So as many of us are using smartphones and tablets, the ability to display information, to send and receive healthcare information, and apps and other types of services available through those mobile technologies is mHealth. Excuse me. The last definition there is gamification, or gamification. And what that is simply using the elements of games, so video games and other types of games that make it more fun, interactive, engaging, or exciting, to engage the user or the patient to have a better interaction, a better user experience with the electronic information being delivered, whether it's in a mobile platform, other electronic platforms such as a laptop computer, excuse me, or even in the physician's office through interactive displays. So just a quick background on eHealth. Medical information itself has been recorded for quite some time. Some of the earliest examples are in cave paintings from 20,000 years BC in France. Beyond that, the ancient Egyptians performed many medical procedures, actually. They did surgeries and drilled holes in heads to relieve pressure and relieve the demons. And many of these things were actually captured in very intricate drawings and used for learning purposes and to pass the information and knowledge learned down to future generations, as scary as that is. Early communications were often in the form of books, print, paper, and the usual suspects of types of printed materials. For up until I guess the early 20th century, until the advent of electricity and electronics, and the telegraph and the telephone. Many types of healthcare information were communicated by those means during that time in the early 19th century. Later on, as things became more advanced, the internet certainly came into play. And if you remember from earlier presentations, the internet was used mostly for medical research or scientific research at first, a part of that being medical research, so it certainly helped along those lines. But as it became more available to the public, much more medical information was flying around the airwaves, so to speak, or the internet waves. So the government in 1996 developed or implemented a regulatory policy called the Health Insurance Portability Access and Accountability Act. Anyway, you get it. You can read it on the screen. And that provided protections for people to ensure that the healthcare information was being used in the proper form. Now, interestingly, while this was seen as a very good thing, it also slowed the adoption as people needed permission from patients to actually use the information in any meaningful way. And in fact, if you look at the little blue box, that's one of the reasons why you fill some extra forms in the physician's office or at the hospital when you go in. And one or more of those forms is always to allow them to release information to other people, to allow for the reimbursement or payment of your services, to interact with other physician or healthcare providers, to improve care or to get consultations, and to share information and receive information from laboratory departments and scanning, imaging. So if you need to go get an MRI or something like that. But also sometimes you'll notice on the form there's a place where you can put a family member or a loved one or a parent or child. And that allows that physician or that healthcare provider to talk to them about your health situation. Without that signature, they're technically not allowed to say anything. So rather than calling you up and having you come in and sign a form every time they want to talk to somebody, you fill out that one waiver and it covers all of that. So on to mHealth. Next slide, please. So some of the recent develops that we know about, obviously, are smartphones and tablets and other types of portable electronic devices that allow for the on-demand, instant access to information just about anywhere there's a signal. mHealth is just an extension of the eHealth, and it allows you to have on-demand services or apps right on your phone. And there are numerous examples of those types of apps. I have a couple on my phone that allow me to communicate with my healthcare insurance company, that allow me to communicate with my physician and set up appointments, and also to receive lab result data. It doesn't do everything, but it is a pretty good step in the right direction. Another thing that's becoming very popular is through Bluetooth connectivity. A lot of devices are now able to communicate with smartphones and other in-home devices that are enabled with Bluetooth that can receive information. This information can be stored on your phone or tablet or device in your house and collect information over time, which can then be transmitted or shared with a physician or another healthcare provider to provide a good look at what's been going on over time with certain types of healthcare. Some examples of this are blood glucose monitors, blood pressure monitors, and other specific types of equipment for other diseases. Some of the recent developments with e-games is exactly that, using games to help educate, improve health literacy, and actually allow you to increase your levels of physical activity, or to you use your mind to exercise your brain a little bit to get a little bit stronger in certain areas. Health and nutrition, there's a lot of apps out there for calorie counting and meal planning, weight loss programs, and on, and they do it in a game-based format. I have an app on my phone, for example, that I downloaded for this presentation that I unfortunately can't pull up right now. But what it is, it has a cartoon character that's overweight and out of shape, and you actually make him exercise, lift weights, jump rope, go for walks, also eat healthy, plan for meals, get enough sleep, etc. And the idea is, by helping this cartoon character on an app get healthy, you learn healthy behaviors and healthy habits. Next slide, please. So one of the first games that came out like that was from Nintendo. I don't know if any of you remember the Wii Fit with the boards and the ropes and everything that you could use and actually play games while you exercise. Bayer Healthcare Pharmaceuticals makes diabetes test meters. They developed a test meter called the Bayer Digit that interacts directly with the Nintendo system and is used for children to help them manage their blood sugar and their diabetes. Healthcare insurances and companies as well have gotten into the business of gamification apps. I have one on my phone that allows me to do certain things, such as check in, count the number of servings of vegetables I eat, or the number of steps that I take in a day, having a bedtime ritual, and if I successfully complete these challenges, I earn points. A little factoid up on the right, not only do I earn points, but I can actually use those points to buy things. They're usually health-related types of little gifts or tchotchkes but they're pretty cool, some of them. You can buy like a Fitbit and things like that if you get enough points. Sometimes these are also used, though, to help reduce your insurance premiums. So if you can actually document that your health care has improved and your blood pressure has come down, or that you quit smoking, your insurance premiums can actually go down. Another example is some of the e-games that have been used with United Healthcare that allow for children in the classroom, in schools, to participate in healthcare activities, and it's run through their insurance company. It's been proven to be very successful in helping young overweight children lose weight. Next slide, please. Wearable technology. I think we all know about wearable technology. Many of us have seen them around the office or on the streets, and many of us own them as well. But I want to start first with smart clothing, which is very interesting. So they have smart shirts out there, and the smart shirts actually have sensors in them, and it allows for the monitoring of certain biometric or healthcare related activities such as heart rhythm, heart rate, body temperature, respiration rates, and other types of information. It's all wired into the shirt, and it communicates via Bluetooth or cell technology with a chip in it to some sort of a receiving device or software that allows for the collection of the information over time, and again allows for tracking and monitoring of how you're doing with certain things. Another good example of this is the Cronius project in Europe, in which they developed these types of smart shirts, and they are used in conjunction with devices around the home to provide a more complete picture of the patient and their environment and what they're doing, specific to certain diseases. One of the examples is chronic obstructive pulmonary disease. So they measure body temperature, activity, respiratory activity, but they also connect to devices in the home measuring air quality, blood pressure, and blood glucose monitoring to provide a complete picture. All of this information is then shared with a physician or a group of physicians who then customize care specifically for that patient. Pedometers. Pedometers are the most widely used wearable device of all. Simply, they used to be just be little clip-on devices that would count the number of steps per day. While this is still very popular and is now components of smartphones and wristbands, it's still, like I said, very popular and used. However, the wristbands and other types of devices have really taken over from those clip-on devices. We've all seen the Fitbits and smartwatches and Samsung Gear and Jawbone and all the other types of devices that not only measure your physical activity now as far as the number of steps, but they can measure the intensity of the exercise, they can monitor your heart rate, they can have GPS locations so they can track distance and how many miles you went and how fast you went and whether you did laps in a pool or a bicycle or a run or a walk. They track a lot of information that can be shared, which is very exciting. Another example of wearable technology is Google Glass. I don't know if many people of you remember about that, but it was a very interesting technology at the time, and it had a lot of potential, but it wasn't really quite ready for prime time. It never really took off that much. It just didn't fill a need for people. It didn't provide enough value for the everyday person. But it did do a lot of things. It was able to display data, calendars, lab results, photos, and any type of information that you can imagine that you could get from the internet could be displayed on the inside of the glass. An exciting feature that it also had was a video camera. and a microphone. So you could actually live stream your activity to someone else and give them a bird's eye view of what you were doing. Now, this is actually something that's being utilized in the healthcare industry, and there are developers out there that are modeling and developing the software for Google Glass for specific purposes, such as for EMT responders. So an EMT responder can wear a Google Glass specifically designed for them, and that will allow them to live stream what's going on to a doctor back in the hospital, and together they can coordinate care for the patient and apply the appropriate measures or interventions needed to stabilize the patient and then take them back to the hospital. They're also used in types of surgery for various reasons. They can be used for educational purposes to allow physicians to train other young physicians about types of surgery, and they can also use to help enhance the information available to the doctor during surgery, even providing a close-up view of the operating field rather than using one of those big scopes. And they can also consult with other doctors live during a surgery if they need any little help or anything like that. Dermal devices. Dermal devices are very cool technology, and we've actually talked about them here in work a little bit. And these are actually design chips that can be applied to the skin in the form of a temporary tattoo. The advantages of that is that its close contact to the skin allows for more precise measuring of certain biometric measures, but it's also very comfortable, flexible, inobtrusive, and even as good as a wristband it totally removes that, and they can also be waterproof and be worn all throughout the day and then taken off when needed. They can measure heart rate activity, brainwave activity, and they're exploring a number of other ways in which these can be used. Another interesting device is the smart contact lens being developed. One of those is by Google, and they're actually attempting to measure blood glucose by measuring the amount of sugar and the tears in your eye. And another company is making small implantable blood glucose monitors that just slide under the skin and can be left for a period of time that measure your blood glucose every 5 minutes and transmit it to a mobile device. And you can imagine that's a big advantage for people who have to stick their fingers every day and measure their blood glucose. Developing countries, next slide please. Developing countries offer a great opportunity for e-health and the ability to expand and the reach and types of healthcare that are available in these areas. There is a global shortage of healthcare workers of about 7.2 million, so there's a big shortage out there. However, with e-health and mobile health, this allows them to reach more people in more remote areas in a more cost-efficient manner, which helps everybody involved. Some examples of this are mobile health technologies such as blood. They now have blood testing kits machines that can fit in the back of a trunk of a car. They have small MRI machines that can fit on a trailer, X-ray machines, and other types of devices that can be brought out into the field, into remote areas, and used to help diagnose and treat patients. Given an internet connection, you can also share that information with a doctor, maybe a doctor who was unable to get to the remote area. You can have a video conference or audio conference sharing information, and they can help diagnose and treat patients on the spot. And as you can imagine, this may allow one doctor to treat multiple people over multiple locations in a single day without having to traverse mountains and roads and rivers and stuff to get to some of these folks. And it's also an extension of their knowledge and their ability working with other healthcare workers that may not have the same expertise they do, but they can still get to these far places and treat people. Some of the major barriers are just a lack of technology. They may not have the internet even, or computers to be used in the field, or some of these other mobile technologies that I spoke of, but they also lack some knowledge, training, and basic information to help do those jobs. Within a country, there may also be conflicting health priorities. So you can imagine there are outbreaks of malaria, cholera, Ebola that may take precedence over just trying to get some of this equipment for a more standard or routine care in times for just to improve the overall health of the population on a more regular basis. Next slide, please. So the current status of U.S. healthcare, it's really expensive. It costs over $8,000 per person per year to pay for all of the healthcare in the United States. The book put the number at I think it was $4 trillion for 2018 or 2019. I have the number here about $3 trillion per year, and that was for late 2016 or early 2016 or so. The more recent figure that I saw just yesterday was about $4 trillion is going to be spent in 2017, so this year alone. As a result of these rising costs, back in 2010, Congress passed a bill known as the Patient Protection and Affordable Care Act, more commonly known as Obamacare. What Obamacare did essentially was to stretch these dollars in a more cost-efficient manner to help rein in some of the spending, but also improve the quality of care. They promoted value-based health care, and that was reimbursing people for doing a good job, not necessarily based on how the number of procedures they did, as was in the past. What this did, though, was it allowed for the adoption of technology to help stretch those thin budgets a bit further into things such as telemedicine. A good example of telemedicine is someone in a rural area in the Midwest may be able to go to a local office, meet with a nurse or nurse practitioner, and have a teleconference of a private video conference with a physician 100 miles away, and between the two of them, they can diagnose, treat, and develop a health care plan for the patient. Next slide, please. So the current status going on right now is that while the technology is great, the adoption has still been slow. There are many factors involved. Many of them are personal beliefs from both the patients and physicians. They don't want to let go of the information, or they don't trust some things, and that will take time to overcome. One of the reasons for that is there's a lack of unseen benefit a lot of time with patients. If you can imagine having your blood pressure monitored and digitally transmitted, seems like overkill. People don't feel blood pressure, they don't notice it even exists, and they just may not be willing to do it. Same thing with blood glucose monitoring. A lot of people are just reluctant to do it, so these technologies aren't going to catch on. I note on here that millennials and other people such as myself that are early adopters that will be able to and will push for more on-demand, easy access and mobile technology to allow for the more personalized delivery of healthcare. However, along with all of this access comes security issues. Hackers, right? Big deal. Over a period of 3 years between 2010 and 2013, there were approximately 30 million data breaches. When I say data breaches, those were individuals who had their healthcare data breached in some manner or some way. And while the response to that has been good and appropriate and really tightened up security, it also caused some problems. If you look at my little factoid in the upper right-hand corner, one of the issues we're dealing with is the interoperability between systems. If you think using MacBook with Pages and a PC with Word, or just a Mac and a PC in general, or an Android and an iPhone, they don't always get along well. And this is really evident in the healthcare industry, as there are many platforms out there that don't work well together and lack the ability to easily share information. The problem is so evident that even in certain hospitals, there may be 2 or 3 different systems that a doctor or a nurse may have to log into to get at your complete healthcare information, because the systems within the hospital don't even talk to one another. So some factors to watch going forward. The growth of smartphones and tablets and the mobile technology is going to greatly increase the use and expectation for a more personalized, consumer-driven experience. The expectation is that just like we were talking about earlier in the class about cutting the cord and not wanting just the generic TV channels, they want a more customized approach. And people are looking for the same thing as well. They want to pay for the health care they want. They want to get it in the way that they want. They want it in a convenient manner. They don't want to have to take a day off work to go to the office. So you can see things like commuting actually or telemedicine taking off and allowing for more convenient access to healthcare. Some of the other things that are out there is all of this stuff now is digital, big data. People are dying to get their hands on the big data and to see what it can do to help improve healthcare, identify trends and outcomes, but we're just not there yet for a lot of reasons, including interoperability, healthcare laws, privacy restrictions. It's going to take time to overcome. But at the end, what we're getting at is truly personalized medicine, right? So not only is this going to be on demand and when we want it and how we want it on our cell phone or in our homes, but it's going to be specifically tailored to us. As I mentioned earlier, with all the personalized sensors that can be done and tracking of your information, not only can it be tailored to you, but going a step further, genetic testing, DNA testing, and other types of testing are going to be used to really tailor specific targeted healthcare plans and procedures and medications to affect you and your disease appropriately. Some other factors to watch, I've alluded to it about the smartphones and everything, but there's going to be a lot of new opportunities out there for the use of these types of technology. The FDA recently issued guidelines around this regarding apps. So companies are developing apps to be used with their drugs or devices specifically. And because they're specifically used with FDA-approved devices, now the software or the app or a website needs to be FDA approved as well to make sure that it works properly and is safe for the patients. If you notice the little cartoon up there, the person was frozen 20 years ago and they were using version 2.0, but now that they're going to get defrosted, they're using version 4.0 and they can't defrost the poor person. So my question to you guys is, with all of this technology and we're getting smarter and people are thinking that they're going to be able to create life in a petri dish, it seems like we're starting to play God a little bit. And while knowledge and wisdom is good, and there are many examples of that in the Bible, Adam and Eve were also kicked out of the Garden of Eden for eating of the fruit of the tree of life, which was wisdom and the knowledge of themselves and immortality and all things. As a result of that, they were banished from the Garden of Eden and cursed with death. And you can see the quotes there from the Bible that speak specifically about that. So given God's view about being all-knowing and having cursed man for that, are we going to reach a point where all of these wonderful advances that are God-given and help us to live longer and healthier lives, is there going to be some sort of a limit to that? And will that limit, either directly or indirectly or known or unknown, be put in place by God? Is He going to put the kibosh at some point in time about how much we are able to learn about the human body? So thank you for listening to my presentation. I wish you all the best of luck and have a great semester. Bye.